it's going, so just ignore that. It won't do anything for the majority of it. So yeah, when we sort of spoke, you just had like quite a powerful sort of story of just sort of like the volunteer who'd sort of been introduced to the sector in some way, and then had gone on to make friends, and then 8 years later you're still here and really passionate. And it kind of got me thinking that there's sort of almost two stories in there. There's one which is like, maybe, and tell me if I'm putting words in your mouth and tell me off, but one was like an introduction to the refugee sector, and working with refugees from sort of the guys who volunteer in the holiday scheme. And then there's another which has sort of come out, which is like working from the professional Dr. Patti perspective and all those issues that go with it. So I was wondering maybe we could just sort of have a chat around those kind of things, and you can sort of lead where you think is more important or what you're more passionate about, but sort of with a view to those areas, if that's okay. So your experience as the volunteer and the holiday scheme. Why don't you tell me a little bit more about that and Abbas and your friendship?
Well, I guess I come from a background of caring about human rights, because I've been a member of Amnesty, and the Medical Foundation emerged out of Amnesty. And when my husband and I were a lot younger, we were busy, we were both GPs, we had kids, but we came and visited the premises just to see what went on and see if we could do anything. And I can't remember who invited us, but somebody invited us to one of these corporate entertaining sort of events, which was educational. So John McCarthy was talking about his experience. And during that event, somewhere or other, we heard, somehow or other, about the holiday scheme. And I thought, well, maybe I can't use my medical skill at this stage, but I'm a mum and I like looking after people, so surely we could have somebody come to the house and look after them. So I applied. That must be 15 years ago. It might be more, I'm not sure. We have difficulty in remembering exactly. And the first client that was referred was Abbas, who was a young Iranian man, and I'm not sure if it's fair to tell his whole story, but he had been badly tortured. He had escaped, come to this country and had therapy here at Freedom from Torture. And since then we've had a number of visitors who are all different in the way that they, whether they open up or not, and what they need from us. But when Abbas arrived, after our evening meal, we all sat down in our sitting room and he told us his story. And we had never actually heard a story direct from a torture survivor's mouth. And our kids were there.
How old were your kids at that time?
Who were... where are we? 15. About maybe 12 and 14, something like that. And they were, we all were very profoundly moved by his story. And during that week, I learned such a lot about the problems for a torture survivor. In that I had this approach, which I think a lot of people in the country may still have, that once somebody's here, they're safe, and they're okay, and they can just relax and get on with life. And that is absolutely not the case, because what we learnt at that point was he didn't want to be here, he wanted to be at home in Iran with his family. That's where he wanted to be, but it wasn't safe for him to be there. And he's a very intelligent young man. He was able to explain to us, what do you think it would be like if you had to go and live in China for the rest of your life? How would you feel? So that was the first eye-opener. And we offered all of our guests to keep some sort of contact with them after they left. Some did, some didn't. Abbas is the one that we've kept the closest contact with. And I think it's probably fair to follow on that with the fact that we learnt so much more about the problems of getting here the journey to get here, but also the problems caused by the asylum situation, by the asylum process in the UK. We had another Iranian who came to visit, who we kept in contact with for quite a number of years, and it took him 14 years to get his
14 years of instability and
not being able to work, and he was deeply angry and resentful about the whole thing, and that was quite a learning journey for us, to not feel cross with him for being angry with my government, who, he's not being tortured, he's safe, said my head. But of course I realise now, but he's being treated very badly, and he's not being treated with dignity and fairness and justice. So I completely got why he was so angry.
And I guess being a human rights, interested in human rights, you kind of get that injustice.
Yes, absolutely. As far as my journey with all of this goes, I had another part of the work that I did. I was a GP, but I was also an examiner with the GP exam, and that came to an end for me. I chose to move on from that. Therefore, I had more time. Therefore, I decided I'd like to see if I could do anything clinically here. So I came and met with the lead doctor and had an interview and started to work 8.5 years ago as a clinical assessment doctor. Seeing people with medical problems, nothing to do with asylum applications or medical legal reports, but with medical problems, trying to help them to understand what was wrong, trying to help them to understand how the NHS works, and to try and be an advocate for them by writing to their GP or other clinicians with my insights and suggestions. So I've been doing that for 8.5 years. The story with Abbas continued because he came and spent Christmas with us. He came for holidays occasionally with us. We visited him regularly in London. He's an extraordinary man because he spoke 7 languages but not English. He went off and learnt English, learned all about computers, and he now works in an international firm that installs computer systems in international banks and such like. And he met a beautiful lady who he married, and he's now got 2 daughters. The littlest of whom is only a few weeks old, which is why it took him a while to reply to my email, because he's just all over the place. He's exhausted. But what he did say was, yes, he would be happy to, give us a quote or attend to it better. That's fine. Once you're back, and he's just had a baby. Yes, those things have a wonderful habit, don't they? Of just time. Absolutely. But I think that he has always been very grateful to our family. But I think we have learned every bit as much from him as he got from us. We've met his mum when she finally came over to visit, and we've understood the complexities of living in asylum, out of your country, exiled in exile from your homeland, and all that made up who you are. So he came to both our children when they got married. He came to their weddings, which was very special. Our kids were thrilled that he was there, and we've continued to visit, and we'll go down and see them again after the little girls. Anything else? No, I think that's it. So it sounds, quite. It sounds like it's had a really profound impact on, not only understanding the asylum system, but also just on you as a person. Yes. And I think it's helped that particular experience that we've had with Abbas. I think we're very, very fortunate to have had it, because what it does do is it helps me in the work that I do now, because I do see torture survivors at a very difficult stage in their asylum process, very often while they're seeking asylum, and I do, a tiny little bit to try and help their rehabilitation, because Freedom from Torture, I know, have a holistic approach, so we don't just offer psychological therapy. We consider their situation, their asylum situation, but also their housing and their benefits, any other issues they might have, but also their health. Many torture survivors have chronic pain, and that chronic pain, the experience of the pain is woven into the emotional and psychological distress that they have as well. If you imagine having a pain, if you understand what it is, if you sprain your ankle and you know that's why it's sore, that's fine. But if you sprain your ankle and you don't know whether it's broken or not, it's a wee bit harder to deal with the pain. And that's something that I was very aware of in general practice, that pain is linked with fear and anxiety and apprehension. So chronic pain that's been usually caused by such horrific experiences, it's not surprising that there's a huge emotional psychological element. Am I drifting off the point?
No. This is, don't be worried of drifting at all. That's great.
So yeah, so I therefore when I see clients, and I mentioned that I'd seen this Iranian today, who has got chronic pain, and who is a very intelligent man. He's come from a very highly capable position, a director of his own company, to being an asylum seeker in the UK, and is understandably struggling with it all. But I feel more empowered to genuinely say to him, it is possible to make a life again, because I know somebody who has made such a fabulous job of making a life, and he's not the only one. He's a close family friend, but he's not the only person that we met who came to stay who made something of their lives afterwards, despite the mess that they were in when they first arrived. So I feel when I say to that man, it is possible. I know the journey feels overwhelming at the moment, but it is possible for you to be able to build a really meaningful, productive life in this country in the future.
You sort of touched on some of the frustrations that people see and that you witness. I've heard bits and pieces discussed about the asylum system, but you also mentioned that you helped them negotiate the NHS, and I was wondering a bit more about that actually, because I think of some of the frustrations that I have with the NHS, which is like, I can't get a doctor for the next 3 weeks, or I can't see the same doctor all the time. But I'm also obviously speaking from quite a position of privilege, because I'm in a country where I had access to free healthcare. And so I'm wondering what that you sort of touched on this as maybe a slightly different experience. So it'd be good to hear a little bit more about that actually in our NHS.
I think there's quite a bit about that. From the client's perspective, starting there, it depends where they come from and what sort of healthcare system they've been used to. There are many clients who are used to not having a free at the point of access health service. There are some clients who come who are used to seeing non-medically qualified practitioners, traditional healers. There are people who are used to particular health issues being dealt with by specialists. So if I'm diabetic, I go and see my diabetic specialist for treatment, and they don't understand the concept that the family doctor, the GP in the UK, actually is a generalist, a specialist generalist as it was, and oversees everything, and actually manages a lot of chronic disease in this country. So number one, it's very important to check out what their ideas and concerns and wishes are about what's wrong with them. But it's also important to explain to them that if the GP doesn't refer them to a diabetic specialist, that's not poor treatment. Because sometimes they come to see me because they think the GP is doing nothing, but they don't understand that the GP is actually giving them the service that they should be having in this country. So that's one quite helpful possibility. And perhaps, I don't think I've ever introduced somebody to the concept of medical care as opposed to traditional care, because most people are aware that both are possible. But obviously in a new country the traditional healer is not here, so that they're kind of stuck with what we've got. The other big issue you mentioned, having difficulty getting to see a doctor, is exactly that, because commonly our clients don't have one GP that they see all the time. I mean, that's not a common thing for anybody now in the NHS and general practice. That may be because they're moving around, because they're in initial accommodation and they're moved somewhere else. They may be moved somewhere else. If they do end up getting status, leave to remain, then they'll have to move again. So medical care is not necessarily consistent from that perspective. But the difficulty is, because of the way that GPs organise nowadays, they may not see the same GP even if they're at the same GP practice. There's also a proportion of people whose GP will not know that they are an asylum seeker or a torture survivor. That may not be in the medical records that the GP has, and it's dependent on the client deciding if that's something that they feel able to share, want to share, or have the time to share, because GPs have 10 minutes. And if you factor into 10 minutes, which is woefully inadequate, interpreting services, that doubles the length of time you need for a consultation when you have an interpreter there. And many GPs don't have easy access to good medical interpreters. So it's a big struggle for GPs to deal with this particular client group. And I see my role as trying to empower them and help them to feel more confident in looking after them. I think the other element is that usually in those early stages our clients are living in very poor quality accommodation, which is in very underprivileged parts of towns, not necessarily just London, which don't attract the highest quality of GP.
Yeah.
Sorry, am I talking too much?
No, it's fine. I was just making sure I hadn't turned it off, because this is all wonderful, really wonderful.
Because it is difficult. There are some doctors who want to go and work in inner cities, in places where you really need good doctors, but it's difficult to attract them. So it may well be people who are perhaps older, because it's difficult to recruit newer doctors, have older ideas, are not familiar with the complexity of the issues that torture survivors present with, asylum seekers and refugees present with. And I see my role as trying to help them.
I guess there's probably no training for torture survivors really for most GPs.
No, not at all. And there is a little bit. There is. I'm also involved with the training department at Freedom from Torture in delivering a training package for people who are likely to experience torture survivors in their walks of life. And there's loads that we cover in that, but part of what we're trying to encourage people to do is to not be frightened of dealing with torture survivors, because a lot of people think torture survivors, this is specialised, they are terribly delicate people, and I could get things wrong and I could make things much worse for them. That's a very, very common perception in people who attend our courses, and in some people that I've spoken to over the phone from charity organisations like Red Cross. When the facts are that if you are kind and respectful and listen and try to do what's possible within your sphere of competence, and perhaps try to help that person access some other sort of help, you can't do anything wrong. So actually being a kind, respectful, thoughtful, empathic person goes a very long way to helping torture survivors and I call it a journey. It is a journey along their journey. There is a bit of research, and I'll need to look out where it comes from, which was not just with torture survivors. It was conducted with women who were victims of domestic abuse, who were also refugees. Victims of sexual violence. I'm so sorry. So it was domestic, but it was also torture.
Yeah.
So there was a mixed group of women who were trained by the organisation, whose name I can't remember, to do their own research on this group of women. So it wasn't outsiders coming and doing the research. It was trained members of that community doing the research. And surprise, surprise, what some of the things that came out of it was that what really helps refugees and asylum seekers who are victims of violence is the same GP all the time. So they build up a relationship and they have consistency. Being able to access the GP and having time to explain problems with the GP and having an interpreter. And it's so basic, but it's just a wee bit of research, but it actually proves that it makes a difference to their experience.
Yeah, I guess it's one of those things that as soon as you say it, you kind of go...
Yeah.
You think of all the things that kind of go with trauma and the kind of things that most torture survivors have been through, that complete breakdown of trust.
Absolutely.
And the complexity of having to explain what happened to you in a foreign language.
Yes. Absolutely.
To somebody you might not trust, that you've never met before, in an unfamiliar situation. And then obviously, as you said, those three things.
And so when I'm consulting with one of our clients, I check how they get on with their GP. I check if they see the same GP all the time. I check if they've had an interpreter. And I always address that in my letter to the GP. So I would write a letter to the senior partner and make him aware of the research and I'd ask him, please could you ensure that by and large they see the same doctor. I check if the GP knows their background and have their permission to just let the GP know that they are a torture survivor, so that the GP is aware that there's all that as well. And I always use the term respectful, but respectfully remind them that they have a duty to provide interpreting services. They can't ask people to bring their friends and relatives to interpret for them. They just can't. They have a duty to provide interpreting services. And that will be possible through their primary healthcare trust, some way or other. They just may not have accessed it previously, or it might be a bit of a faff, but they need to do it.
Sort of helping ensure rights, and I guess it's part of your role as well, in sort of access to medical services. Yeah, I have heard, as you said, sort of some stories of somebody bringing along a child to act as an interpreter, and that sounds...
There was one lady who really needed to go and see the consultant in hospital, and who had, I think, gone along for 4 appointments. The first one, her friend had gone with her, so the appointment had gone ahead. The next 3 times, her friend, it wasn't even a friend, it was just somebody from the same country that she'd met in the accommodation. The next 3 times she didn't have anybody with her, so when she arrived at the hospital, they said, we can't do the consultation, we don't have an interpreter. You need to bring somebody with you. So I actually contacted the hospital trust, the language department, the interpreting services, to find out what the problem was. And the problem was it's an unusual dialect, but that's their problem. They need to solve it. You know, And again, I always, I might feel cross inside, but I always remember how hard pressed one is in the NHS, and try to be facilitative and encouraging, rather than you should be. Never helps.
Yeah, no. It's really interesting that you mentioned like all these sort of barriers with language as well, because we've also got an appeal around English classes. So there's a volunteer here called Annika, who's been setting up English classes.
Fantastic.
But it's just volunteers to help refugees learn and asylum seekers here learn English. Yes. But there's no funding for it. So it was just very interesting you hearing. What do you think of sort of FST's sort of initiative then to set up some peer-to-peer volunteer English classes all over the UK for asylum seekers? How do you think that would impact them medically?
I think it is enormously helpful if clients are able to learn English, and I understand all the barriers that get in the way of them being able to focus on that, sometimes for years.
Yeah.
So I don't think it's an easy option. I think it will help them in life in general. I do see some clients who have reasonable social English, but I see them with an interpreter, because the detail of their health and the detail of asking symptoms and the specifics of the body and how the body works, and trying to help them to understand and trying me to understand what they're thinking, really requires a wee bit more sophisticated a vocabulary. Than
I guess this you can't miss.
So I totally, it's a brilliant idea, great thing for life in this country. But I think it takes quite a while. I have consulted with a small number of people in English who are very fluent, and it's lovely, because of course consulting with somebody directly is a very different experience from consulting through an interpreter, because it is a very direct communication, person to person, whereas the communication through an interpreter is very much a triumvirate. It's very, very much something that three people are involved in.
Yeah, I guess that must be a bit interesting from the sort of doctor-patient confidentiality thing, even though they're there with that in mind. It must be quite a different experience. One thing you sort of mentioned was just how, and I'm definitely going off topic here, but it was so interesting. And it was you talking about the NHS being under strain, and all I can think of is just the last few days, all I've read about is the NHS and the cyber attack, but also Jeremy Hunt rearing his head again and saying that they're funneling money into it. And I have quite a few friends who are doctors, and I was curious to get your opinion just on, what's happening with our NHS and, how you, as somebody who works with survivors of torture, think that these things are going to impact people that are in need.
It's going to be dreadful. I'm incensed by what the government has done with the NHS, because my professional career as a GP, from the early 1990s onwards, it's just been change after change after change, the majority of which have had political motivations as opposed to health motivations. I think some of those changes have been very valuable, in that it is important that GPs are able to demonstrate that they're making a difference to people's health. So I think there were some introductions that were really useful from that point of view. So we are accountable. We don't just busy ourselves in GP land, which we used to do without anybody noticing. And we are we are required to demonstrate how well we're treating our patients with chronic disease. So it's not just a case of having a register. We have to show that we're actually managing effectively to get blood pressure below this level, that we're reducing the number of strokes, that we're keeping diabetics under better control with our therapy. So I think there have been some bonuses, but I do not understand how the government can sleep at night. Various governments could sleep at night telling us that they're putting loads and loads of money into this service when they have so many people, thousands and thousands of people who work in this service who are just not able to provide the service anymore. I mean, since I retired 4 years ago, it's worse. They just can't run the service. And I understand that it's enormously complicated because there is a difference in what the public demand and expect. There is a difference in what is understood and detected and diagnosed, and there's a difference in what's treatable and manageable, a lot of which costs money.
Yeah.
And somewhere or other along the line, I have to say, I think there needs to be some very overt, very detailed discussions about what the NHS is for anymore. You know, what is this cradle-to-grave healthcare going to be, and what is going to be included and what isn't? And that's very difficult. But if they carry on as they are, I mean, it's ridiculous. I disagree entirely with privatising national institutions anyway. The NHS, the railway, the post office, any of them. I totally disagree with it. Because it hasn't, I don't see any benefit to anybody in doing that, and I see a whole lot of harm in the NHS. The pressures on the staff, you'll know from your pals. I don't know what the percentage is, but it's significant, of young doctors that qualify and push off overseas. They just don't want to work in such a pressurised situation. And I find that tragic, because when I was involved in teaching and training and assessing, I could genuinely, hand on heart, say to all these new bright-faced young doctors, it's a brilliant job, it's a wonderful career. And I don't feel I can say that anymore. The actual doctoring bit is fantastic. But I was a doctor when I looked after patients, I was their GP. I looked after the whole family and all the kids when they grew up and they had their kids. And I think somewhere or other the government just does not understand the benefits of that.
And that's quite sad.
Anyway, sorry.
No, that's all right. I thought I'd ask just because it's obviously something you're very passionate about, and I could see there was inklings of I want to shout at someone there. And that's something that I can very much sympathise with. So that maybe we sort of end on a positive note, and I don't send you away angry. Sort of either to the pub or to go punch some minister. When we initially started talking, we were talking about our shared future. So I guess maybe if we could sort of get your thoughts on what our shared future would mean to you in the context of your friendship that you've made with different people along the years. And your experience in general, what would that mean to you? The whole line itself was different pasts, shared future.
I mean, my experience with clients of Freedom from Torture, right going back from the holiday scheme days, has without a doubt and with hand on heart been an entirely enriching experience for me, for my husband, for my children. And I think that's something hugely powerful, that these are some of the most vulnerable people on the planet, and yet I have been so enriched by meeting and forging relationships with them. And I wish more people did. I wish there was a greater openness and willingness to listen and to understand each other's backgrounds and to share each other's backgrounds. Because of course I learnt a lot from our friend who had 14 years before he got his passport about his situation and the difficulties he was struggling with. But he learnt a lot about us and our family and life in the UK that wasn't living as an asylum seeker in London, that was actually living in a normal family, living what passes for a normal life in the UK. And I would certainly encourage anyone with doubts about whether to get involved or to do anything, even if it's to contribute to the services offered to such people. The old First Nations American Indian saying that you shouldn't judge a man until you've walked a month in his moccasins. And that's what it's about. It's really listening and hearing and trying to understand what it really must have been like, and what it must be like to come to this country in such a vulnerable situation. And it's just, over and over I hear my therapist friends rejoicing when something wonderful happens with one of their clients as their new life begins to take shape and they develop a real true independence and direction. It is extraordinary, the resilience and the healing power that we witness, and that's something else that we learn from. I don't know.
That's perfect. That's absolutely lovely. Lots of
But Abbas will be a friend forever and ever.
It's always so nice to hear those stories because, you know, if you work around fundraising or campaigns and stuff, I mean, you know, so I was involved with Amnesty for years and I worked there before I came here. And so you kind of, you know, here as well being fundraising, it's like, right, well, we need people to give us funds, so read this terrible story and this terrible case file. Yeah. And let's see if we can get somebody to give us money, or like we need to incense people with this campaign, out with the shopping thing, and you kind of just sort of can end up going, oh my God, the world's rubbish.
I know. Yeah, and I think that's the thing. That's why the shared future is so important, because it's very easy to be overwhelmed. It's so dreadful and so awful, and at times incredible that such things could have happened to an individual and they're still here, surviving. That it really is so important to remember that there are those shared futures ahead. That, you know, we do have British citizens who may not be international athletes, but are really important members of our British society. You know, let alone being friends, that contribute to the richness of what I think British society is becoming and should be.
And with a bit of compassion and understanding.
Yeah, definitely.
We can get there.
Yeah. Absolutely.
Absolutely. It's so nice to hear your take on positivity, because every so often you just get so swamped, and then you said it was like, yes, this is why we're here.
Yeah, definitely.
Thank you. That was amazing. That was, I mean, let me just put this on and turn that off now. Not to sort of